My name is Dr. Jonathan Kirschner, and I'm a physiatrist, also known as a specialist in physical medicine and rehabilitation, and I diagnose, treat, and help rehabilitate injuries related to sports or spine issues. Physiatry is a relatively new medical specialty, been around for about 50 years, so not that new. And really we're focused on function. So a lot of patients think about doctors related to a body parts. Orthopedic doctors are bone and joint doctors, and neurologists treat nerves. Physiatrists really treat function and loss of function, and that can be related to injuries due to sports or accidents, trauma, falls. The important thing is really to come up with a good diagnosis. So that's part of it, is really finding out what's actually wrong. My approach is also to figure out what are the risk factors or what are some other things that maybe someone's doing in daily life that led to it. Because we can treat your initial injury. 99% of people have back pain, so I always tell my patients, if you have back pain, you're probably normal. Everyone gets it, and usually it goes away. But for me, it's really looking at risk factors. Why did you develop the back pain? What can we do to prevent this from happening in the future? And that may be related to how you're living your daily life, whether it's your posture and how you hold your body, how you do your daily activities. So if you're sitting at a desk all day, maybe you don't have the best ergonomic setup. If there's a particular exercise you like to do, maybe there's a better way you could do it more safely to prevent pain, that sort of thing. One of the things I specialize in, and I've actually written a book about, is ultrasound. So ultrasound is great because we can look at soft tissue in really high resolution, in some cases, most cases, higher resolution than MRI. And anyone can have an ultrasound, whether you're pregnant, whether you have a pacemaker, and it's painless, it's relatively quick and easy. We also have an automatic comparison. So if you have a problem with your right shoulder, we can always compare to your left shoulder to see for comparison, because everybody's a little different. What's your normal may not be someone else's normal. To me, knowledge is power. You have to be informed. So I'm not the kind of doctor that's just going to tell you what to do and then expect you to go off and magically you're going to get better. I mean, we're really partners in your healthcare, and so I really want you to understand what's going on. It's your body. It's most important to you. So I want you to take ownership of what's going on, because also the treatment has to do a lot with the work the patient's going to put in. So I want my patients really invested in knowing what's going on, and so that they're motivated to really help get these things better. Because a lot of our treatment is going to focus on rehabilitation and exercise. It takes a little bit of hard work, but the outcomes are usually pretty good. So one of the most gratifying things I can do is have my patient come back and just be very happy and thankful that we've restored some part of their life that they couldn't do before. So whether it's going up the steps to be able to visit their daughter who lives in a walk-up, or being able to go grocery shopping at a store that's a little bit further away, that's really, really rewarding.